Your long COVID symptoms, fatigue, dry mouth, joint pain, brain fog, may not just be long COVID. There is now peer-reviewed evidence that that same virus that caused long COVID also triggered changes inside your salivary glands and your immune system that look exactly like Sjögren's disease. And most of the people experiencing this have no idea because no one's tested for it. Hi, I'm Dr. Kara Wada. I'm a quadruple board certified allergy, immunology, lifestyle medicine physician. I also live with Sjögren's disease, so I sit on both sides of this conversation. Today, we're talking about the connection between long COVID and Sjögren's disease, and specifically the new research that is making a lot of us in rheumatology and immunology pay very close attention to what we've been calling just long COVID. Save this before your next appointment. I want you to have this information in your hands when you talk to your care team. And as always, this is not medical advice for your individual situation. This is for educational purposes only. If you have concerns about your own health, please work with your care team. Okay, let's get into it. Here's where the science starts to get really important and where I want you to pay close attention. Sjögren's disease is an autoimmune condition. It causes the immune system to, among other things and across your whole body, but it particularly has a focus on moisture-producing glands, primarily salivary glands and tear glands. That's why dry mouth and dry eyes are hallmark symptoms of Sjögren's disease. Now, here's what the research is showing us about SARS-CoV-2, the virus that causes COVID. The virus uses a receptor called ACE2 to enter the cells. And it turns out that your salivary glands have very high levels of that particular receptor, which means the virus targets your salivary glands directly. Once it gets in, the virus triggers inflammation inside those glands, and that inflammation causes changes that, under the microscope, look indistinguishable from Sjögren's disease. There was a 2023 study published in JCI Insight, one of the more respected immunology journals, and they took salivary gland biopsies from people who had just recovered from COVID-19, and these people had no prior autoimmune diagnoses. What they found stopped a lot of the researchers in their tracks. The tissue under the microscope looked like Sjögren's disease. The immune infiltration pattern, the gland damage, it was present in the majority of the people they biopsied. What's interesting for me is clinically, I made a shift in my clinical practice around 2020. And it was around that time that I started focusing on seeing more patients with MCAS and Sjögren's disease, or folks that suspected they had those symptoms. And it wasn't uncommon to see this pattern that they maybe had some symptoms prior to what was going on, maybe not, but COVID seemed like lighter fluid on top of whatever they were dealing with. It's not uncommon to have many long COVID patients describe dry mouth that doesn't seem to go away, eyes that feel really greedy and irritated like there's sand, or an eyelash in there at all times, no matter how many eye drops they use. And there's fatigue that feels different than regular tiredness. It's not dehydration, it's not anxiety, and it's something that we can actually see in many cases under the microscope in that glandular tissue. All right, let's talk a little bit more about this. So stay with me. We're getting a little more serious here. Autoantibodies are proteins that your immune system produces when it starts to mistakenly target your own tissue. In Sjögren's disease, there are two specific ones that are most commonly talked about. That includes anti-SSA, or Rho52, and anti-SSB, or LA, although that one, we need to do a whole nother session all about the intricacies of that. But these are the antibodies that we tend to test for when we suspect Sjögren's disease. And SSA is a part of the classification criteria, which for many folks is what is defaulted to when we look at particular diagnosis criteria. The same 2023 JCI Insight study found that COVID-19 patients showed significantly elevated levels of both of these antibodies, both anti-SSA and anti-SSB, compared to healthy controls who had not had COVID. These aren't random antibodies. These are specifically the ones associated with Sjögren's disease, and now they were showing up in people who had recovered from COVID and previously had no prior autoimmune diagnoses. And here's the part that connects directly with your long COVID experience. In 2026 systematic review of the Lancet Infectious Disease, they looked at 44 studies involving over 3,000 long COVID patients. 71% of those studies found an association between autoantibodies and long COVID symptoms. More specifically, a separate study of 106 convalescent COVID patients found that people who still had detectable anti-SSB antibodies 12 months after infection, and they were significantly more likely to have persistent fatigue and persistent shortness of breath. So the antibodies weren't just present, they were predicting who was going to keep struggling. Now, there's a reason this matters beyond just having a name for what's happening. Because Sjögren's disease and long COVID overlap so heavily in their symptoms, the fatigue, the dryness, the joint pain, the brain fog, the anxiety, that Sjögren's often is being missed. It often is being dismissed as just long COVID, and it means people are not getting the right care. So let's talk about the population level data, because this is the part that really made me want to sit down and record this video. A community-based study out of Massachusetts looked at people who had been diagnosed with a post-COVID condition, and they compared their health outcomes to people who had not had COVID. What they found was that people with post-COVID condition were 4 times more likely to later on be diagnosed with Sjögren's disease. 4 times. And that's a pretty decent sized signal, and I would say that this is less likely to be coincidence. There also was a large Korean nationwide study which included nearly 7 million participants, and it found that the risk of Sjögren's disease was significantly elevated after COVID-19 infection. Among people who had severe COVID, those that required intensive care admission, the risk was nearly 3 times higher than the general population. In a German matched cohort study of over 640,000 COVID patients, they found a 43% higher likelihood of developing a first onset autoimmune disease within 3 to 15 months after acute COVID-19. Sjögren's disease was among the conditions with an elevated incidence. Now, I want to be honest with you about what the research does and does not tell us. These are all observational studies. They show association. They do not prove to us that COVID directly caused every one of these Sjögren's diagnoses. What they do tell us is that there is something there that we should be looking at. There is something there that we can measure, and it's large enough that we need to look more into that and look for additional studies that may tell us more specifically what this relationship is. Is it truly cause and effect, or are there other contributing factors? The other thing worth knowing is that, and this is something that frankly breaks my heart, is that the average time from symptom onset to Sjögren's diagnosis is historically around 3 to 6 years. This is data from even before long COVID existed. The symptom overlap between long COVID and Sjögren's disease is so extensive that Sjögren's may be getting written off as just long COVID, and that, I worry, could add to that diagnostic delay. So what can we actually do about it? I hear from so many of you that the information in these videos is helpful and that it can also feel overwhelming. So I want to make sure that I leave you with something you can actually do this week, not just something to worry about. Something I feel really important about is helping people feel like they have some agency over what is going on when often they feel like they have no control over what their body is doing. So here's what I would suggest. Number 1, track your symptoms with a little more specificity before your next appointment. Rather than saying, I'm just tired, I want you to note the specific symptoms. Did you have dry mouth that wouldn't go away despite a lot of hydration? Eyes that feel dry or gritty? Joint pain that really feels more like stiffness? How long did that stiffness last? Does it ease up at any point along the day? How does your fatigue change with activity? Does it get a little better, or if you do too much, are you out for the next few days? The more specific you can be, the better equipped your clinician is going to be to help connect the dots. This costs you nothing and takes a few minutes a day to jot down some of these notes. Step 2, ask specifically about Sjögren's if you have symptoms that are suggestive of it. Often what will happen is if there is concern about autoimmunity, sometimes what will be run is an ANA. ANA is kind of this lupus test, although that's a gross understatement. of what it is. And often a true full evaluation of Sjögren's is going to include an ANA, but often what I see and some of the gaps I see in lab evaluations when I see patients in my clinic, often the SSA and or SSB or some other supportive data is never obtained. So that is some specific language you can use. Current expert consensus supports a symptom-triggered approach, meaning if you have symptoms, you should be evaluated. And now you have some better language to ask for and advocate for that evaluation. I also have a free lab conversation guide. The link for that is in the description, and that is also a good place to start. Step 3, do not accept this is just long COVID if the symptoms are not resolving and if you haven't had a full evaluation, if these symptoms are suggestive. So long COVID, other autoimmune diseases, and in particular, we're focusing on Sjögren's disease here, there's a lot of significant overlap. That overlap is real, it's documented. We'll have the links to the papers in the comments below. And if you have persistent dry eyes, dry mouth, your dental checkups have gone from good to really poor. If you have fatigue that is just unrelenting, joint pain or stiffness, if you are experiencing things like dysautonomia, POTS, super common with long COVID. Also, Sjögren's is the #1 autoimmune cause of dysautonomia, which POTS is a form of. It is really reasonable to ask whether an autoimmune workup has been considered or has been completed. You're not being difficult, and you are working on connecting the dots that a system that's built for quick fixes just sometimes isn't really structured to help support. If you want to learn more about living with Sjögren's disease and living well with Sjögren's disease specifically, we have a virtual Sjögren's Summit coming up this July. It's our 5th annual event, and it is happening July 16th through the 18th. It brings together physicians, researchers, other clinicians and healthcare team members, patients, advocates, folks across the spectrum to talk about this kind of emerging evidence. We're going to be talking about the clinical trials for treatments that are ongoing and other strategies to improve our health and come together as a community. The registration link is in the description. The summit opens this July 16th, and we would love to see you there. It's free to attend live, and then there's a paid option for folks that want long-term access to those recordings. Now, if you have been living with long COVID symptoms and been told repeatedly that everything looks fine, that it's anxiety, that you just need to rest, that it's probably just stress, I want you to know that what you're experiencing is real. It is documented, and it is being studied by researchers at some of the top institutions across the world. We talked about data today from Massachusetts, Germany, Korea, across the globe, right? We know that this is a big problem, and it can be really frustrating sometimes when science takes time to develop, but we're doing our best here to bring that to you as we are able to read and share and communicate that. I also want to say the fact that it has taken so long for you to work on getting answers is not at all your fault. The system is really challenging for those of us living with multiple symptoms across our entire body, all those different systems. And often most of us tuning in here live in systems where those visits and those symptoms and those parts and pieces of our body get separated out rather than kind of seeing things from that whole. My question as we wrap up this is, did your Sjögren's disease symptoms start or get significantly worse after a viral infection, whether that was COVID or something else? I know every time my kids bring home a sniffle, my dry eye, my dry mouth, it's like the volume gets turned up. So I would love to hear what your experiences have been. That helps me understand what our community is experiencing, and also your comments help me decide what content to focus on next. So until next time, be well and take care.